Hi, everybody. I'm Dr. Diane Hayden, and you are listening to The Path to Healing recordings with our expert practitioners from across Connecticut and Florida. And we are talking today about mental health and natural therapies for dealing with stress and anxiety and depression. And I have three awesome ladies on here today with me. I'm going to tell you a little bit about them, and then we're going to just jump right into questions and things like that to have this discussion. So I have Seema Dasani on with me. Her education experience spans over 30 years in corporate and wellness settings. She's a licensed professional counselor and a certified holistic health counselor. She specializes in holistic psychotherapy, and her core focus is true nourishment. Her work is well suited for people who feel stuck and want to live a more conscious life, a life strewn with a deeper sense of meaning and contentment. The technique she uses is called eidetic imagery, which provides a visual and visceral way to access stuck and frozen hurts and pain so they can be examined, worked on, and metabolized to enable a healing elixir to flow into the mind and body. I also have Tatum Page Roble with me. She's a licensed marriage and family therapist, a women's empowerment coach, and co-founder of Seven Farm, which is a functional mushroom company focused on holistic healing of the mind, body, and soul. As the host of Tatum Talks, featured on Hulu, and founder of The Balanced Woman, she helps women slow down, listen inward, and live in alignment with their truth. With advanced training in internal family systems, Tatum believes we are made up of many parts and that healing comes not from fixing, but from understanding. Through her original 3Cs, 3As, and 3Ss framework, she helps others move beyond diagnosis and return to their wholeness, authenticity, and humanity. And Jenny Alzate is a Hispanic integrative psychotherapist. She's a three-time winner in the category of Top 10 Holistic Psychotherapy voted by Natural Nutmeg readers. She is also a certified mental health integrative medicine provider and the founder of Jenny Alzate LPC and co-founder of the Enlightenment Counseling Center. She's been working in the mental health field for 25 years, and her clinical focus is on women's mental health issues, mood and stress disorders, family therapy, spiritual counseling, and healing unresolved childhood trauma in adults. Jenny utilizes an eclectic clinical approach to help heal and restore the mind, body, and spirit. So welcome today, ladies. How are you all? Happy to have you guys on today.
Very good. Thank you.
Thank you.
Awesome. So I'm going to throw out some general questions for you guys, and anybody who's on today can certainly pop some questions into the chat as well. While I'm asking questions and you guys are just answering, if each of my expert panel can in the chat just type in any contact information that you want our readers to know. So just put in your name, whether you want website, email, phone number, anything that you want our listeners to be able to have to reach out and contact you. So this is the number one question because of what you all do. Why you could have gone down, I suppose, a different route in terms of how your training is in psychotherapy or counseling or things like that. But why did you choose a holistic route? Like, why do you believe in holistic therapy for mental health?
I mean, I'm happy to kind of jump in and talk a little bit about that. I think it didn't always start that way for me. When I got my degree as a licensed marriage and family therapist, I was very much focused on mental health in my younger years. And as I've worked with people and I've expanded and I have worked more specifically with women and done a lot of my own work, we aren't just mental, right? Like we are these, what I consider, I mean, you hear the phrase spiritual beings having a human experience. And for me, I feel like we are mind, body, soul, and you can't separate those three things. I mean, we still have a culture that does, right? But I do think that because we're mind, body, soul, it's all interconnected and we're constantly in this space of interconnectedness with self. And so to only focus on one aspect means that we're ignoring something else. And I think true healing, whatever kind of healing that might be, comes from integrating that understanding that we are the sum of all of our parts. We aren't just a bunch of individual parts to be healed. So for me, the more I work with the population I serve, the more that I see that. And so that's what the transition was for me, is recognizing how beneficial it's been to be a holistic practitioner, to see the work I do as necessary when treating the totality of a human being and not just parts of them.
Right. And we talk about this all the time in relation to like natural medicine treating, chronic disease, right? If we're looking at the body, the person as a whole person, like a whole being, like you
Mm-hmm.
said, spiritual, mental, physical. So it should carry over into, dealing with mental health issues that we're looking at as a complete system as well, right?
Yes, yes, absolutely.
Yeah, and I just to kind of like add to, from my perspective, I think for me, we've talked in the past, Diane, born into a home, a family, a culture that spirituality was a focus and nutrition was a focus, and using your mind to create and manifest was a focus. So I was, born into a family that already kind of had these understandings and these values. And for me, it was beautiful, once I was in the career and I was already a psychotherapist in 2015 to discover mind body medicine. And so it was more like I already believed these things. I practiced these ways of perceiving myself, life. And now there's an actual science-based, curriculum model that really takes mind body medicine, meditation, breath work, affirmations, whatever it is, and it's a legit counseling practice. So for me, that was really, kind of how I came professionally to it. And then from there, there's been such an involvement in our world, our culture, the remembrance of being holistic beings, the understanding of spirituality. And so the world wants to understand this perspective as well. And now, as professionals, we have these accreditations and certifications that also add to our professionalism that say, here we are, and these modalities work and they're evidence-based, and they work and they heal.
Yeah. Do you know how amazing it is that you were born into a family that believed that?
I know we've talked about
I
this
wish I
before.
was.
Yes, yes,
Yeah,
yes, it
that's
was.
pretty wild.
But it was beautiful because there were hardships, right? And so we've
Yeah.
talked around kind of to me that was the balming medicine to move through the hardships of life. So even though I was, obviously very blessed, it came, at the price of obviously some challenges, but those challenges allowed me to experience these modalities and feel the healing, from them as I navigated my life. So, but
Right.
yes, very, very blessed.
Yeah.
Yeah.
Seema, how about you?
Yeah, I actually kind of think of it as a homecoming. I was looking at my childhood stuff, and this is a cover of a book that I was brought up with. I was brought up in a pretty spiritual family, and this book's title is called Journey of the Soul. And
Mm,
this represents the soul, and that the first page is this beautiful golden page about how we're all from this ocean of light and love, and all of us are like these soul droplets. And so I love that that was kind of my anchored upbringing in a pretty, we had mentioned it to you, Diane, like I'm an Indian woman brought up in Hong Kong, so it's a very like achievement focused society. But I was fortunate enough to have the grounding of a spiritual upbringing. But when I left Hong Kong to come to America for college and then, work and all of it, I kind of left that all behind, got into type A mode, achievement mode. And then in my mid 30s was when I kind of hit the first wall, which led me to go back to school to become a holistic health counselor, learned about kale and quinoa and eating and mind. And that was great until I hit another wall. And then I got into more spiritual ideas and pursuits, which is great until I hit another wall that said, okay, what is really this life that's wanting to emanate and live? And this kind of aligns with sort of, there's a life that wants to live through us, probably as we enter the second half of life, which is, at 39 was when I hit that wall. So having eaten right, thinking right, spiritually playing, and then it's like, what is this? All of the stuff that's covering my soul, all of these conditioning and all of that's covering it up, that's seeking healing expression. So for me, it's just a homecoming. It's almost like a remembrance that holistic is almost shouldn't even be a separate word. And in fact, the core root of the word therapy or psychotherapy represents the coming home to soul. I mean, that's really the genesis of even that word. So the fact that we have to add holistic in front of it It's almost redundant, but
Right.
that's where we are, because people have compartmentalized it in such a way, you know.
Yeah, I agree for sure, for sure. Um, so each of you, I think, have kind of maybe mentioned nutrition and diet, and that's one of the things I wanted, one of the questions I wanted to pose to you guys, because I think we're learning more now how important nutrition, what you feed yourself, what you put into your body is in relation to mental health. Whereas before, I don't think there was that connection. Like we didn't really understand, well, how does our gut affect our brain, and how does it affect our moods and all of that. So what are your thoughts around that, and when you work with your clients, what kinds of recommendations are you giving them around nutrition and diet, and how that either can make your anxiety better, resolve it, or make it worse, make depression better or worse, that kind of thing.
I mean, I can share. I mean, I think that, the gut health piece is maybe the focus more in the sense of, the kind of the mind body connection with the anxiety and depression, but nutrition is a big piece of caring for your gut health, right? So I think being able to understand that connection holistically for us as practitioners is very powerful, because when we're treating a client with anxiety or depression, chronic, we know that they definitely need some support in that gut health area, right? So referring them to a naturopathic doctor or a functional doctor, whatever it may be, is an important aspect of healing for me, because we can do all the work, but if the gut health is not balanced, that microbiome is, living in its own chaotic world, it's still going to come back. It's going to exacerbate what's going on. So I think just, us knowing that as practitioners and educating our clients on it is super powerful. And then I think nutrition, of course, has such a huge impact on prevention and the creation of, mental health disorders as well. And I feel like that's just a whole conversation on its own. But I always just start with, what are you bringing into your body right now? Let's just look at what is happening first, right? And then from there, these suggestions, the alternatives, and these kind of things. But first, education on what you're putting in, spending some time on that, right? And then I think that, like I said, there's a whole field, there's a whole aspect when you really want to look at nutrition as and food as medicine, right? So I feel like that's just another conversation, but they're both crucial and very important, I believe.
Yeah, I don't necessarily lead with that because of sort of the journey of eating and, all of the different things I've learned as a holistic health coach. So I did that for a while. Once I sort of transitioned into holistic psychotherapy, because the work of eidetic imagery is very somatic, it goes into the body. And so I would just sort of have my wisdom and knowledge as a repository here. And depending on the person in front of me, I will then pull out maybe what they might find helpful, in that space. So, but I actually think it's interesting because I feel the importance of nutrition is vital in the work that, especially here in that I kind of work with is like soul making, and so it does require capacity and bandwidth. So certainly, fortunately, I do work with people that's quite knowledgeable already, like, and then they've actually hit the wall. Those are the people who kind of go, I eat well, I think well, my life is still what it is. So I'm not working, having to work with the thing from ground zero, but certainly I can offer some guidance here if they're struggling through something. But I kind of keep that more in the back rather than more frontal. I think people don't seek me out for the frontal, nutrition piece as much these days because I'm leading more with psychotherapy. So.
Yeah, I think I'm pretty similar to Seema. I don't necessarily lead with or talk heavily on nutrition, but also because I am also a therapist and a women's empowerment coach, I find that I talk a lot more with women um, around nutrition and diet and how they move their bodies in the coaching area. And I think that's because I've had my own experiences with it. And so in the coaching space, I can bring my own experience to the table. And so I think what I have learned and what I try to kind of share with those I work with is that our bodies are machines. They're biological machines, but they are machines, to some extent. And the fuel we give them matters. and for women at different stages of life, the types of fuel we're feeding it matters. And so I talk about food more about it being fuel, and not necessarily something being good or bad, but just how it's fueling you. Even I talk to my kids in that way. And I think so what we're taking into our bodies and how we're fueling our bodies is going to be there's going to be a direct correlation to how we feel and how we function. And I think the same is true with movement. We are what, 70 or 75% water. And we all know what happens to water when it sits still and it's idle, and we know what water looks like when it moves and it flows. And so those are the kind of things that I think about, and those are the types of conversations that I typically have with my clients about like nutrition and that type of thing.
Love it. Yeah. So those of you that are on the call as a listener, if you have any questions, go ahead and just type them in the chat, and we will get to those as we go through. I want to ask you guys a question in terms of what you're seeing in your practices now. There was such an increase in anxiety, depression, mental health issues, during 2020 and beyond, and probably still today. Are you seeing those rates kind of decline a little bit now? Are they staying the same? Are they even increasing? What are you guys seeing in each of your practices?
Yeah, I think that's an interesting thing to answer. That's a tough question to answer because I try to figure out like if there is a correlation. Yes, absolutely. When COVID hit, I think all of us, whether we are practitioners or we were, patients or clients, we are all experiencing this kind of acute, it felt like trauma, like what is going on, complete loss of control, like chaos for a while. And there definitely was a need to process that. And so it heightened. And so I think for me, what I have seen now is not necessarily like an increase or decrease in anxiety or depression or mental health stuff, because I think that that's always there, right? That's always just been there in our world. There was a precipitating event that kind of brought more of it out and had people feel so out of control that they sought out services. And I think through that process, mental health has become more of a mainstream thing that we can all address and that we can all talk about. Like mental health and physical health is more integrated. I'm hoping, and I think, that's my experience on my end. But I also believe that there are some people who through the pandemic maybe realize the level of help or support they need, right? Because there were people who were maybe in domestic violence situations that were now stuck in the house with somebody, who was, who was creating more chaos. There was people losing their jobs and financial issues and relationship struggles as a result of that. And so I think that in that moment, issues came to light because of the pandemic that people started to get treatment for. But then I also think there are those sets of people who kind of feel like, well, all right, life has gone back to its regular groove in some ways, and I can just kind of blame my situation. I can put it in that pocket and compartmentalize it to the pandemic, and they've kind of swallowed it all back down and moved on. Because I believe that we can't, like, everybody gets there when they get there as far as wanting to work on themselves. So I definitely think that there are more people who are more aware of their mental health. I'm not sure that that has created like an influx of people seeking it out. I just think that it's highlighted the need for the work that we do, which I think also has a tremendous benefit.
Right, right.
I love that sort of. I think Tatum, it kind of covered like the external, like I kind of when I was sort of in that space, what I felt, and again maybe it's more of the orientation is I just felt the normal distractions and dopamine hits were taken away, so people were kind of left to themselves, and when you're like left to yourselves, the stuff that's always been in the distractions to cover them up are no longer available. On top of that, it doesn't help that every news channel you go on, there's a ticker. I still remember like a CNN ticker, something like how many people are dying, how many people, So that's in your field all the time as well. And I think, that external piece, but I genuinely feel people's stuff was coming up. And so therefore the people I knew that already had an inner life. I remember actually watching an Ariana Huffington interview one time, of Huffington Post, and she was like, there's so many people like dealing with outer space travel. What about inner space travel? Like, and I love that. It's the idea of like people
Mm.
getting comfortable with the inner landscape. So I definitely feel like the people that were more comfortable in the interiority and silence and solitude were navigating it a little bit better than, but I think I look at the people that were then struggling. It's like, this is an opportunity, right? I mean, and that's why we see the influx. But to me, it's like these symptoms are, I always call it soul making. It's great. It's coming up now. Great. And in this, one of the pages in this book that I showed earlier, it says, actually, when it's time to heal, some symptoms like depression or anxiety may show up. I mean, this isn't a children's book that I was like, it's almost a gift
Yeah.
if we
Mm.
can see it as that and start to address the deeper. So,
Mm,
yeah.
yeah,
Yeah,
good
I mean,
point.
I agree with both. I'm sorry. I agree with both of you ladies, and I think it's not necessarily in terms of treating clients because of COVID right now. That's not really increasing necessarily, but it was an opportunity to face your depression. It was an opportunity to face your anxiety, right? And so there were some people that really were very sick during that time, and there were some like me where I was like, oh, this isn't that bad. You know what I mean? So it really kind of like met you where you were at. And so if we look at it that way, we look at our current state of the world right now, there's so much stress out there as well, right? So in a way, it's like life helping us, right, with these external mirrors of like, okay, what's happening for you right now? And it gives us information when we, a lot of people live in denial or disconnected. So yeah, so in terms of the clinical focus, that's not necessarily what people are coming in for, but I think, people could say that triggered a lot or that activated a
Mm.
lot, and that's kind of what we're working with now. So yeah, that's what I would say about that aspect.
Yeah, and I think overall, just it allowed people to be able to seek out mental health treatment without feeling such a stigma around it, right? Like,
Mhm.
I think it made it more acceptable, and more people were now talking about it and going to counselors or therapists and things like that. And so it made it easier, I guess.
And
So,
telehealth really took off during the pandemic, which
Mhm.
made just the service more accessible to people.
right.
You don't have to travel anywhere. And so that's really when I entered the fray, when I kind of got into the fray is when the pandemic hit, is when it's like telehealth became the norm. And now it's like, yeah.
Yep. Yep.
And I
Became
think
just
that
more
also
accessible.
like helped us in the sense of the relationship with the client, the patient, because right, we're all home, we're all going through the same thing. There's a naturalness of your child in the back or your pet so it really was like in a way also a connector with the clients, and it created a warmth, more nurturing environment, nurturing, that's the word. While we were all in that together. So I think those could actually be positives
Oh,
that
yeah.
came out of that experience as well.
Yeah, for sure. So I want to talk to each of you a little bit about the uniqueness of what you all do. So Jenny, you mentioned somatic therapy, and some people listening to this might have never heard of that before, or whatever. So let's talk a little bit about that and how you integrate that into work with your clients.
Sure. I mean, so a big focus of my work is working with clients with PTSD, or CPT. Well, I can't even say the word. Complex post-stress traumatic disorder. And so, they're coming in, presenting a certain way, a lot of, frozenness, inability to really express, to speak. And so for this type of client that really has a difficulty kind of, starting with expression, right? We have this kind of bottom up approach, which is really using the body as a way to connect. And it's very safe, it's very nurturing. And the idea is, really depending on what's happening with that client, but maybe starting with like a body scan, something like this, where we're identifying some sort of dysregulation in the system or pain or discomfort, right? One way of using the somatic work is to kind of connect to the emotion through the body, and really using the body itself as a way to move it through, to listen to it, to give it a voice. So it really becomes a very intuitive kind of practice, really meeting the energy where it is, and connecting through the body and then using the body too to also kind of, move it through, or bring it up to present to work with it with whatever other modalities we want to use. So it really is just another approach to tap into unresolved, deeper emotions, and that sometimes, we really just can't find the verbiage to kind of express. It's also just kind of like if the client's coming in activation, it is just really a way to move the energy through, to help them be more present. It could also be a client that suffers from depression, right? It could be a modality to increase energy, vitality in the body. So there's many different ways of using the somatic approach, to help the clients, that are suffering with PTSD and not able just yet to share the story.
Right.
Mm,
I think that's
mm.
so interesting, honestly. Like that, who would think that you could receive and actually have, therapeutic process by moving your body in a particular way? Like I think most people think, maybe not so much anymore because there's so many different types of therapies, but most people when we think about psychotherapy, we think like, oh, talk therapy, right? Like I'm going to be sitting on a couch talking to the LPC or the psychotherapist or whatever. But now it's like, oh no, I might be moving my body. I might be, dancing.
I might be dancing, right?
Yeah.
I wanted just to share, just to add to more of that holistic practices, like this, even me preparing for this interview today, just to understand the simplicity and the power of these modalities, knowing that when I get a little nervous, my hands will get cold, right? So the awareness, holistic, let me use a blanket, let me warm the body up. I went into some imagery, right? So this is what I'm saying. This is what you'll get in a session, right? So I saw myself in the beach and I was really, relaxing my system. And I was doing the 5-5-5 breath to really anchor myself, to bring me in here and just really calming positive thoughts, right? So these are the techniques that you learn on top of the processing, the, moving it through verbiage, but it's beautiful, right? Because we understand biologically, physiologically, what's happening when I'm doing all these modalities. They're simple, they're easy, and they help.
Wow.
So that's the
Very
beauty
cool.
of this. Yeah.
Very cool. All right, Seema, how about you? We talked a little bit about in your bio, you do work that is called eidetic imagery. Can you tell us a little bit about that?
Yeah, so it's funny because I've been trying to describe it, and I'm just going to lay it down. So eidetic images are just vivid, specific images that you can see. So they're like watching a film strip or a movie scene. Like you can see it. It's very concrete, and they have an alive quality. And to pick up on what Jenny said, the three aspects of an eidetic image is the image itself. It's alive, right? It's living. It's present. You're watching it. It has a somatic component in that you'll either feel something in your heart and or your body. So if you see an image and it doesn't engender that, you're kind of in a memory. It's not an eidetic image. An eidetic image is very alive. And then the third aspect, which is part of the ISM, is the meaning. So the image somatic meaning is the ISM of an eidetic image. So and the way I work with that with people is again, people get very stuck. People often come with like, oh, I had this parent, I had this childhood, I had this, I had this. So they have a preset story of their lives. And so the way I work with people is using the eidetic imagery, bring them back into present state. It could be oftentimes I'll work with a present day problem to take them historically what's going on. So I might say, you asked, I think, some of the things about relationship problems. Again, we tend to get stuck in a narrative you know, oh, my husband's this way, my spouse is this way, and I have a whole like abstract, and they'll talk. They already have it all figured out, right? They have an abstract kind of thinking about that person. So I might say something like, see an image of you sitting across from Joe, right? And so they'll have a whole like, okay, I see Joe do the blah, blah, blah. And then this is what I'm feeling. And then, and then I'll say, maybe now walk to the right of Joe. See the image again. See a picture. So walk to the back of Joe. Walk to the other side of Joe. Walk in front of Joe. Look into Joe's eyes. All these methods, and I'm just giving like literally a sliver of how an eidetic image might work. But by doing that, you start to break the fixity. You start to kind of break apart a narrative that's stuck to say, oh, that's actually, when I look into his eyes, oh, he looks a bit sad, or, it like allows the interaction and the experience to come alive. And oftentimes the use of these images is to really bring clarity to a fixed narrative. It's to break that apart so we're not so at the effect of it. And so we can loosen the grip. And it is a highly somatic thing too, because oftentimes I'll have people connect with how does it feel in the body, and or like, where does it feel it? And they might say, oh, my thighs feel really strong, or my head feels really sharp. Like it's great. It is a true mind body healing, that happens.
And
Yeah.
also, I think when you ask someone to look at the person from different angles, it's
Yeah.
almost like you're looking at that person with new eyes.
Exactly.
Yeah.
Exactly. Yeah, exactly.
Yep. I love it. I love it. And Tatum, how about you? Let's talk a little bit about internal family systems and what can you explain that and how it works?
Yeah, yeah, for sure. It's so interesting. I know this is I will get to internal family systems, but it's so cool listening to these other women talk about what they do because as I'm listening, I'm like, yeah, that kind of fits with internal family systems a little bit. Oh, that's kind of like something. It's all connected. It's all
Yes.
connected, and there's all these different amazing angles and ways to like approach your wellness. I don't know. It's so. I'm just listening, and I'm
I
like, this is
agree.
very cool. Everybody should just be working together.
Right.
Oh man, but internal family systems is or IFS is really about this idea or concept that we are made up of parts, right? So Richard Schwartz was the fellow who created the model, but basically the easiest way to break it down is this concept that you know there's a part of me that wants to do this, but there's also a part of me that wants to do that, or there's a part of me that feels scared about this, but there's a part of me that feels excited, right? We are just like constant parts, and all these parts get created over time from the moment we're born up into the current moment we're living in. And when I try to explain it to people, the easiest way to like get a visual of it is to think about that movie Inside Out. If you've ever seen it, Pixar made it. But it's like a kids movie, but it shows this girl having all these like memories and experiences, and they all get put into these little orbs, inside her mind. And then these orbs are stored, and some of them are core memories, and some of them are just moments of fear and etc. But basically with the internal family systems model, what we're trying to do is allow the person to truly be able to hold space for all of the parts that they have. So instead of pushing them away or avoiding them, or again creating narratives about who they are because of these particular parts, we are looking to hold space and to heal them and to create wholeness. So in the approach, it's that we want to be operating from self, or what I call center. We want to be operating from our most authentic self. And so the way to do that is to look at these parts. In our part, the way that the parts break down are there's exiles, there's managers, there's firefighters, and then there's the self. And all of those parts are trying to help us, even though those parts might end up being dysfunctional. Their intention is always positive, right? So the exiled parts are the things we carry around, our traumas or experiences that we've had that have made us feel fearful. And then the manager parts are there to kind of protect us. So they're things like needing to have control, being people pleasing, over functioning, etc. And then we have these firefighter parts, and those firefighter parts are usually impulsive and reactive. So they might be things like substance use, or being like very impulsive in our decision making, or being avoidant, or addiction, things like that. And so the idea is that as I sit with somebody, I am holding space for them first, and I am allowing them to start to bring up some of these exiled parts and get them to become aware, almost like a third party viewing themselves. Be aware of when you're in your manager parts, be aware of when you're in your firefighter parts, and then allowing them to slowly forgive and to nurture and to heal. I know this might sound like it lacks compassion, but I heard it once and I was like, that is so true. Like, nobody's coming to save you. Like, when you're an adult, nobody's coming to save you. You learn to save yourself, right? I've read a lot of Mark Manson, and he has a book, The Subtle Art of Not Giving an F, and I will let you fill in
I
the
love
blank.
that book. He's great.
Yes. And he talks about the responsibility fault fallacy, and this idea that just because something wasn't your fault doesn't mean it's not your responsibility to heal it. And I use that a lot when I work with clients and I'm using IFS, is that you are your adult now. You are your safe person. You are the person you can count on. You have all the tools. You can create the resources, but you have to be able to hold space for all these, what I consider like childlike parts that want to come up and say, I'm not good enough. Well, what if I can't do it? Right? All those things, is to be able to hold a genuine, compassionate space and invite them in. And so the idea is that as we heal those parts, we return back to wholeness, we return back to self, and we become more in alignment, and we become the most authentic version of who we are, the most healed version of who we are through that process.
I love that. I think what all of you do is very empowering, right? Like we're talking about taking responsibility, for just because something happened to us doesn't mean we now don't take the responsibility for healing that trauma or issue or whatever. But what you're all saying, it's really about empowerment, right?
Mm-hmm.
Yeah.
Yes.
Yeah. And it's like if I pick up on what Tatum said, it's like an accept when we start to accept these parts and they start to lose the sort of the hold they have on us. And the word I like to sort of introduce also is like as we heal, there's an alchemical thing that happens. So there's a transmutation of some of the like I had a very strong control part that was very willful. And now it's like, hi, how can I help? It's like it's changed. I still need that part to get anything done. But
Right.
it's changed. It doesn't have to operate in that willful, controlling manner because the healing has occurred and that wisdom and that experience is folded back into me. So that sense of authority can just be in my presence rather than in the way that I go about it. So that's also, and another image I think, Tatum, you talked about, having all the parts is I think of having a banquet table. I'm like, come on, let's all eat together. No, I'm not trying to make
Yes.
you go away or you're everyone's welcome. Let's just be, but like let's all get along and let's all work together, for
Mm-hmm.
something. So yeah.
Yeah. Yeah.
So I was just
Exactly.
going to add too, like I also use IFS in my work as well, and doing inner child trauma work with high functioning adults, we're kind of going really deep down before you can even see that part or take care of it. There is so much inner battle with these parts that we have. The part that was abused, the part that was neglected, these childhood parts that were not treated well. The adult, it's, has so much unconsciously hate and shame and frustration and anger towards these parts, even though they were the ones that were hurt, right? So it's really like helping that present day adult build compassion for their child selves, let
Mm-hmm.
alone like work with that part. First, it's interesting to find how much inner judgment the adult has. Well, why didn't you say anything? Why didn't you leave? Right? These expectations that the adult mind would have. And it's like, this was a child with no power, with no one to listen. So I just think it's so beautiful because it really is. And I personally have seen so many women heal. And that word I would love to talk about too, what that really means too, but really come to a full acceptance and working with and compassion and love for all of their parts, but it is fascinating how much inner judgment exists with the pain parts, that lack of compassion, right? Because it was just so bad. Why do we have to go through this? So it's just the model really just helps you kind of work with all of it, the way that it originally is, and then to reframe it, to shift it and transmute it. But that's an interesting aspect too. Before we can befriend and work with, we gotta like accept and love the pain part. And I feel like that's my work, is to develop that, to create that compassion and that love between the adult and that inner child. So just kind of adding on to the beauty of the practice. And yeah, it's so powerful. I mean, really like working with people with eating disorders and addiction, and being able to just work with that part and see it more as, what do you need right now? What did that part, when that comes in, that desire, what does that part need? Oh, she needs to be heard. She's overwhelmed. Okay, well, let's not get caught up in the behavior right now. This is a sign. There's a part wants to communicate and is saying, I need something from you, right? So really being able, a client that's been in, that went through years and years of treatment, to now be able to be like, okay, I'm not going to be afraid when the part comes up. I know I have choices in the behavior, but also what does this part need from me right now? So it's just really this beautiful integration energy.
Yeah. Yeah. I agree with you. It's so cool.
Yeah, it
Mm-hmm.
is. It's beautiful.
I think the other thing is really, really neat is that when we can talk with people about their parts, it allows them to not see that they are that thing, right? Like that that I am this thing. It is just a part of me. And I think Sima was talking about like the narratives. I think that that's part of the work with IFS is like changing the narratives. Like I always say to my clients, well, what else could possibly be true, right? Life isn't either or, it's both and. Yes, okay. So angry that you didn't leave. And I see all of the fear that was there and the reasons why you didn't, right? Like, so whatever it is so creating a new narrative, like what else can be true, I think helps create that compassion that you're talking about, Jenny. Like it's so important. And in my work with women in coaching, I created the 3 C's and the 3 A's, which was compassion, curiosity, and courage, paired with awareness, acceptance, and action to try to help my clients as they're dealing with those parts, ultimately to be able to take courageous action in their own healing. Because yeah, we aren't just one thing, we're a bunch of things, and I think it's a really beautiful, beautiful approach and practice, and I love it.
Yeah, that's awesome. So Jenny, you actually brought up a good question that didn't even think to ask, so I'm going to ask it. What does the word heal mean?
I love this. I mean, clearly subjective, right? I mean, I think we could probably ask people, and everyone might have a different understanding of it, but really 20 years in the work here, doing this for a long time, I don't think these parts go away. I really feel healing is the work, the knowing what you're working with, the knowing how to tend to yourself when these parts come in, building that compassion, that child, adult energy, that reassurance, like I got you when you look at your kid's eyes and you're like, you're okay, you're safe. That is healing, to have that healthy, loving relationship. And yeah, there are some, behaviors and symptoms that we do eradicate, of course, that are not, healthy for you. But in terms of the pain parts or the experiences or the memories going away, never. I mean, they will always be there, but it's learning how to really be okay with that and how to center and come back to presence. And just be ready to be there for yourself, So I feel like that's a very general kind of definition, but I think it's not getting rid of, it's like really being with. That's what I feel.
Yeah, I mean, I think that it's important to not get into this idea that we're going to get rid of things, because there's a judgment there, right? Of like, these things are wrong, I have to get rid of it. And I think that is exactly what IFS says. It's not about getting rid of them, it's about welcoming them home. It's about being able to say that, yes, this thing is probably going to bother you, but how do you manage it when it comes up? Are you still going to become super reactive? Is it going to traumatize you? Or are you going to use it as like, oh, hey, I see you there. I see you there coming up for me. Okay, what's my awareness about it? And how do I manage it? So yeah, I agree with you wholeheartedly. My clients will say to me sometimes, like, I just want to get to the point where this doesn't bother me anymore. Or I want to get to the point where I don't act like this. And I'll say to them, I hope you understand that it's probably never going to not bother you. How could it not? Right? How could it not? And I think that's the acceptance. That's the welcoming home, which is like, of course that's going to bother me. And then how do I respond to it? How do I stay in control? How do I stay in self and respond to it versus being caught up in all of these exile part or all these manager parts or firefighter parts and become reactive to it and then, throw myself out of balance. So yeah, I agree with you. I think it's not about getting rid of, it's about welcoming in and accepting.
Yeah, I love that. Before I forget, Jenny, can you put your contact info in the chat when you get a second?
I will.
And I think that all of you guys, all the things that you guys are doing are very like cutting edge and exciting, new therapies and things like that. But I also wanted to ask, is there anything you've heard of recently that you think is really cool in terms of working with mental health issues? It could be anything, like any kind of like new modality or new therapy or anything that you've heard of.
I mean, well, I want to be delicate and not, and where I go here, but yeah, as you know, me and my partner, we own a mushroom farm where we work with functional mushrooms, obviously legal functional mushrooms, things like lion's mane and reishi and chaga, turkey tail, all those things. And that is a holistic thing that I use in my practice too, that I bring in, especially lion's mane having neurogenesis properties, creating new neural pathways. It helps us, especially people who are experiencing anxiety, depression, anything that might be trauma related. It helps the brain kind of rewire itself in ways that make us less likely to be reactive to those things. So to me, that's really new and cool. Obviously, I am somebody who is very much integrated into studying and being aware of what's going on in the psychedelic world and the use of psilocybin and things like that. So while it's not anything that's legal here yet, there's so many amazing, amazing, amazing studies being done, even as close as Yale, about the benefits of psilocybin, which is a psychedelic like component of a mushroom, to treat PTSD, to treat trauma, to treat addiction, to treat migraines, to treat anxiety, depression, mood regulation. So to me, that's cutting edge. That's really, really cool. That's coming down the pipe. I love seeing, I'm really into the integration part of the therapeutic integration part of that work. People who do take journeys in places where it is legal, and then dealing with the integration, meaning the therapy that goes along with integrating the awarenesses that came up during that journey, and how to sustain that long term. Because I think some journeys can create like a pink cloud effect, and then you fall out of that pink cloud eventually and back into life. So to me, in my world and in what I study, that's new, that's innovative, and that's super cool. I love that.
Yeah, I'm glad you brought that up actually, because I was just, as you were talking, it's interesting because things like ketamine
Mm-hmm.
are, I mean, so I have a magazine down in Florida as well, as many of you know. And it's interesting because there's like a lot of ketamine based therapies
Yes.
and, practices and things like that down there,
Mm-hmm.
which blows my mind because they are so behind the eight ball when it comes to like naturopathic medicine and not licensing the naturopaths down there. But yet they're doing things like ketamine and
Yeah.
very progressive stuff with, stem cells and things like that for other types of health treatments. So yeah, I was gonna say, like, what are your thoughts on something like that, which is kind of in this realm of what we're talking about right now?
Yeah. Yeah, I mean, I am all for it. Obviously, I don't know as much about ketamine or DMT or anything like that because they're not my area of study, but all very similar in how it affects the pineal gland and all of these things. So, um, I am for that. I think sometimes, like we've all talked about, our brains get us stuck, right? Our brains get us stuck. We are our own worst enemies sometimes. And being able to have something that allows us to open up some of those floodgates without the ego, and really be able to embrace a potential new reality, a new narrative, a new belief system, like almost instantaneously, and then be able to integrate that into our life. To me, that's so powerful. That's just so powerful and incredible for healing.
Right, because it's really like rewiring your brain, right? Like it's
Yes.
creating new neural pathways, so you
Yes.
so you literally think differently.
Yes. Yes. 100%.
Yeah,
Yep. So,
I'm not as familiar. Like I've attended a few psychedelics, conferences and stuff like that. But one of the concepts that resonated, and I could see the way that different holistic approaches kind of try to look at this is, I guess there's something, and Tatum, correct me if I'm wrong, but there's something called the default mode pathway,
yes, the
right? So
default
that's
mode
like
network.
the default mode network. So that's the part that's like overact, like very active, rehashing old memories, old, and some modalities like psychedelics, and I would argue even eidetics and some of these things, when worked through, the idea is we change the makeup, we change the narrative, we change the fixity of perception that allows that part to get the rewiring, allows the neuroplasticity to kick in. So I
Hmm.
just think there's like many different pathways to, the wholeness, which is, I guess, in healing we talked about earlier. I mean, to me, it's just the kind of returning to home, returning to wholeness in a more wizened fashion. That to me is the healing. But I think that's what I would say. Like in the realm of, like you asked Diana, any cutting edge. I mean, it's so funny because I think because I came at it with the food, the mind, the spirit, and then now the therapy part. It's like I mean, I have so many tools of consciousness. I call them tools of consciousness. And it's like, I'll just be guides saying, oh, you use this EMF thing, or use this frequency plate, or use this life wave thing, or use this biophoton thing. I play. I have a
Right.
sandbox that I play in. But would I say, hey, this is the Holy Grail, this is the Holy Grail? I would actually not, because I actually think, again, each of us, when we connect to that soul part, that part is, I used to give people advice all the time, like, do this, do this, do this. And now I'm going, okay, let's connect you to your inner guidance. Let you have that GPS internally that even if I were to tell you about something, does this click? Does it resonate? That to me is the most empowering place, because homeopathy, all of it's available. They
Hmm.
all work differently. Like I sometimes I'm taking a homeopathic thing for grief because I'm going through something with mom and it's helping bring things up. I mean, all this is available to us, but intuitively, is this right? Yeah, it's right now. And how do I know that? Because I'm more connected to my soul intuitive sense. So, yeah.
And that's the big
Yeah,
thing,
I love
right?
that.
Yeah, is helping people get more connected to their own intuition,
Yeah.
right?
Yep.
Oh yeah,
Yep.
definitely.
Staying in alignment with self has so much
Yeah.
value. Being able to figure out what feels aligned.
And teaching them how to know, right? Because I mean, for me, it's always like a lot of people often like, I don't, is it intuition? Is it anxiety? I don't know what to listen to. I don't know how to be, right? So I always try to bring in this lens, this holistic lens of there's many parts within our system, right? So there's the mind. How does the mind perceive? What's the body say? What does your heart say? What does your intuition say? What does your energy say? So this is already planting the seeds of being a holistic person, human being, and then learning how to listen and what it feels like, right? What does the mind say versus the heart? And it's so fascinating because there's one problem, the mind will say one thing, the heart will say another, the body says another. So then it's like, they tap in, they start to feel, they start to connect and experience. And then eventually we get to what does intuition feel like, right? And then that intuition, people will then say, okay, it's just that knowingness, right? And so there's like steps to get there, but yeah, it's like learning how to listen and know that we are, multidimensional. And it
Jenny,
comes
I
in.
want to say one point to that. I
Yeah.
really do, because I kind of try to differentiate whether it's mind play or intuition. And I've learned something that was, for me, valuable, which was
Yeah.
if I come up with something and there's a whole long drawn out explanation, like, oh, I should be doing because, then I know my mind's involved. But if I have a crystal clear clarity, it's like, do
I
this.
know
It's like,
it.
do this.
That's it.
Yes. It's like, okay, that has a different quality to it, has a definitive
Mm.
sense versus me talking myself into it, which is kind of the other.
Yeah. And people with anxiety have a ruminating mind. So for them, we're working on that, right? Because they'll know intuitively, but then the questioning and the fear and then the rumination. So now we lost it. Now it's like frozen. What am I going to do? I don't know. But who do I listen to?
No, that's good that you pointed that out. I was actually going to say that, like, there's a lot of people that they intuitively know something and then they question it, question, and then it becomes like, I don't know, am I making the right decision? I don't know. This doesn't seem, and you get your whole head into it.
Oh, yeah.
Hmm.
Yeah.
Awesome. Well, we just have a couple minutes left. Is there anything that, any other wisdom that any of you want to give, or just anything that you want to leave our listeners with? This has all been really amazing.
This has just been fun. I've really enjoyed this. I've never been able to kind of be on a panel with a group of women who are really inspiring and doing so much amazing work, and that's really cool to see. And I guess that what I'm feeling is probably what I would want to say to anybody listening, which is like different strokes for different folks. Like all of us here have spent the last hour talking about all the different ways in which we approach the human experience, and so there's not just like one right way to approach your own healing. And, we just talked about, does this feel aligned for me? So as you're listening, as somebody listening, it's a really good space to kind of sit in and recognize that there are so many ways to approach your own healing and your own wellness. And these are just a few, right? Like these are just a few of us here. So take some time, be reflective, and kind of look inward and ask yourself what feels aligned, what feels like the right approach or work for me right now based on where I am in my own life. Yeah, I mean, I think that's just kind of what I was thinking. And so perhaps that's what I would share with others.
For me, I would, just kind of also say, just like I truly believe this, that we can all heal, we can all be well. Life is now, it's the eternal now, really. You know what I mean? It's now, it's now, it's now. So it's like a hopeful message that really, no matter what you've been through, and it doesn't negate or take away from our experiences, of course, but having witnessed so many people, hundreds, thousands, really many years of doing this work, we can get to a place of presence and peace and empowerment, no matter what we've been through, right? So it's a general thing, but I do believe this. And so that's the energy that I'm bringing. I think we all bring to the table, that we can all heal, and we have different ways of helping you get there. And that you have the internal compass within you. So why don't you guide the whole thing? So yeah, seriously.
Yeah, I would say maybe kind of looking at symptoms, whatever they are, mind, body symptoms, as like golden. They're golden opportunities for healing. And as they surface, just work with them. I think we tend to, especially sometimes when we have physical symptoms, we'll lament the body. And I remember I was very physically ill for a while, and somebody said, okay, the blood's pH has to be 7.25 for you to be alive. So that's the priority of the body. It's not to do this, that, and the other. Because I was about maybe a lot heavier than I was now, and I was like, I want to lose weight. And they're like, that, sorry, weight loss is the fourth priority of the body. The first priority is to keep you alive. And it did such a miraculous job of doing that. And I think the more we can recognize our psyche, our bodies are doing this miraculous job of keeping us alive, keeping us going. So back into the more psychotherapy part of it, I would say symptoms are golden. Triggers are gold.
They are
And
gold.
to be able to be triggered and not react, give it a pause, take responsible for healing. And a quick hack I will again maybe mention, like the way I said with the other, which is if you walk into a room with somebody that sort of triggers you, and once you leave the room, you're clean, you just know you were around bad energy, and it's like, okay, I can wash that off. But once you leave the room, if it stays with you, then you've got some work to do. And it's about taking responsibility to do some work
Yeah, I
because
like
that
that.
stays with you. And so, but triggers are golden. So I would say embrace them and take responsibility to do the work. It's worth it.
Yeah.
Yeah, I love that. And that's the whole point, right? Like what we were saying earlier is, we just want something to go away, right? Like we don't want to feel that way anymore. We don't want to have that issue anymore. We don't want to have that trigger, but that's how you grow, right? Like it's you almost want to befriend the trigger. You almost want to like invite it in. You want to have the trigger. And rather than being like, oh God, this is, I just want this to be over, just look at it in a different way. Like, wow, this is an opportunity for me. Why am I feeling this way? Why does
What
this
part is
person
coming up right now? What part is coming
Exactly.
up, and what do they need, right? That's when we kind of apply that IFS language as well. Oh, insecurity. Okay. 13-year-old me. Okay. What do we need, right? And then you kind of do the work.
Exactly.
Beautiful.
Yep.
Awesome. Well, this has been amazing. This has been one of the best ones, I have to tell you, ladies. I mean, it really,
You say that to everybody.
I do not say that to everybody, and Colleen's on, and she can attest to it that I do not say that to everybody. We've had some really great ones this year, but this one was great. Just the flow and everything, and all of you sharing so much wisdom. It was really, really amazing and enlightening. So for all of you listening, we'll get this edited and emailed out, and it's going to go out to all of our readers as well. And we'll include all of our experts' contact info, ways to get a hold of them, and learn more about them. And again, thank you, Jenny and Tatum and Seema. It was a great, great call.